I am honored to have Dr. Kristen Willeumier here with me today. She is a PhD neuroscientist, and one of the main tools she uses is neurofeedback. And I know a lot of you out there are like, does that even work? Is that legit? Is that worth my time and my money? So I want to just dive right in and start there.
Neurofeedback is really what I would say, a very sophisticated way of training your brain to be optimized so it functions at its most efficient. You come to me and I might do something called quantitative EEG, where I put a cap on your head and measure the electrical activity of your brain. And what I do is I take that EEG map and I compare it to an FDA registered normative database, which basically says how different is your brain from what we would consider a healthy brain of somebody who is your age and gender. So if you come in and you say, Dr. Kristen, I have headaches, right? And I can't sleep and I have insomnia and I do a QEEG and I see that your anxiety network is more than 2 standard deviations from the norm, I will then use neurofeedback to retrain that brain network so it is back in a normal range. So then you might ask me, well, what does that mean? Okay, so neurofeedback now, the training, which takes about 25 minutes to half an hour, we will put this cap on your head again and get your brainwave, measure your brainwave activity. And I can set very specific protocols that your brain needs to be working within. You will sit down and you'll watch a movie. You might watch a meditation video. Training can be sophisticated where you can actually see your brain wiring. And when it's in the optimal state, it looks green. So you get that reward and it gets you excited. And when your brain sees the reward or hears the reward through the audio, it remembers it. And so each time you come in, we strengthen it. And I can watch in real time what's going on in your brain. I can watch the brain maps in real time.
So, do you just sort of learn what that feels like and then you're trying to make more of it?
Your brain will figure it out on its own. That's the beauty of neurofeedback. So it's really what I love about it. It's a non-invasive, non-pharmacological approach to balance brain network activity. But really the most important point is, how do you feel? Right? What symptoms are we alleviating? Right? Do you have less headaches? Are you able to sleep? Right? Are you able to focus more when you're at work? It's easy to do. And why patients love it is if they're on medications and they're having side effects, sometimes you can use neurofeedback as a nice adjunct way to work with the medications, and like they could work with you to start bringing those medications down as the symptoms get better. So with the kind of training that I do, because I work both the cortical and subcortical networks of the brain, sometimes you don't have to do as many sessions, right? People could work with me for 10 sessions and have a very significant result. Sometimes people need to train for 20 or 40 sessions. It's mental training for the brain, and your brain learns it and remembers it. But you have to do the reinforcement. So that's, again, if you went to the gym and you wanted to get the good biceps and you only went once a month, it's going to take you longer to build the muscle than if you went twice a week and worked with your trainer.
And I got to be honest, it sounds easier than going to the gym. It sounds like your
It
brain,
is.
it does the work of neuroplasticity for you. It gets the right signal. Maybe your brain gets a little dopamine hit or something to strengthen, the firing of that pathway that you're trying to encourage it to fire. And it just sort of does it on its own. That sounds amazing.
It does. It's what we're doing is unwiring the connections that shouldn't be there. So, for example,
Yeah.
if you have post-traumatic stress disorder, through SPECT imaging, there are very specific brain regions that are overactive. We've seen the anterior cingulate and the basal ganglia and the thalamus. So, when neurons are overfiring, it sort of holds that pattern in, and that's why you have the symptoms. So, what neurofeedback can do is very gently start to unravel or unwind those connections. We retrain the brain to a place of calm and balance and peace. And really, that's what I do in all of my trainings. My focus is getting your brain back to the equivalent of what we would see in a normative database.
And it sounds like sort of what's happening is, you're saying the brain kind of goes down a train track until you build a new one.
Yeah,
Yeah,
it's
it's just kind of
learning.
stuck
It's
in this pattern until you intervene, say, no, no,
yes.
no, go on this train, not the, go on this track, not the other one. And then you're going down a different pathway and symptoms get better as a result of healing the brain as a
Yeah.
whole. Yeah.
It's just I call it bringing the brain back to homeostasis.
Mm-hmm.
Right? We've always talked about, everybody's stressed now and their sympathetic nervous system is up and there's chronic stress can rewire your brain. And sometimes we have these patterns that we don't even know we have. I mean, through
Mm-hmm.
my work in neuroimaging, I've seen tens of thousands of scans. So there are unique patterns that we can see in the brain. And our goal is how do we help calm those brain networks down so they're balanced? And when they're balanced, you think clearly, you're more focused, you have sustained attention. You know, to be human is to live a life full of stressors. And so to have this kind of technology and these modalities available that are non-invasive, that can rewire our brain, and our brain does the work for us, it's really quite extraordinary. I'm amazed that we can now start working at the level, the subcortical level. So a lot of people have heard when you're stressed, your amygdala is overactive. That's that
Mm-hmm.
area of the brain that's involved in fight and flight. And when it's overactive, that's when we get anxious and stressed. And a lot of people try to use meditation and yoga and mindfulness practices to calm it down. And sometimes we try really hard with those practices, but it doesn't always work. So we have to resort to supplements or medications. Well, here we have these sort of novel forms of neurofeedback where we can work the brain networks at the level of the amygdala.
And what I love about this is it's about fixing things, putting things back to the way they belong. And then all of the symptoms that were being caused by that underlying problem are now better. And I think that's really
Yes.
the evolution of where we're going with brain science, with neurology, with neuroscience. I really think that's what the future of it's going to be.
It's it's so exciting right now to be in this period where we have
Mhm.
these tools and technologies. And having worked with people who have pain and living with somebody, my husband deals with chronic pain, and pain changes the brain.
Mhm.
Pain makes the brain hypersensitive.
Mhm.
Um, so you can use this technology, even combined with some natural supplements, to help quiet networks in the brain that are hyper responsive to the environment. And I feel like neurofeedback is in its renaissance moment. I feel like you're going to hear more and more about this. People are going to gravitate towards it. Again, this wonderful non pharmacological approach to improve the efficiency of your brain.